Assalamu alaikum dear doctors. In this video we are solving RCPCH theory and science case number 41. Case number 2 is that later the day a 10-year-old girl presents with similar symptoms of worsening lethargy, reduced urine output and dark urine. She reports feeling unwell for over a week and has come to the emergency department due to an episode of hemoptysis. She is admitted and seen by the renal team who think Goodpasture's syndrome and is the most likely diagnosis. So the question is asking us that which one of the following blood test results would confirm the suspicion. So they are telling that for Goodpasture's syndrome, which test is confirm the diagnosis. Let's read the explanation. Goodpasture syndrome is rare in children but is important to consider in pulmonary renal syndrome. Remember, pulmonary and renal syndrome. Characterized by nephritis and pulmonary hemorrhage, usually alveolar hemorrhage. Other causes of pulmonary renal syndrome include SLE, Wegener's granulomatosis, microscopic polyangiitis, and HSP. Goodpasture syndrome is also an autoimmune complex mediated disease, and apart from lungs and kidneys, there is usually no other system is involved. The presence of anti-glomerular basement membrane anti-GBM antibodies in blood confirms the diagnosis. It is important that treatment is started early, and this is usually a combination of corticosteroids and cyclophosphamide as well as plasmapheresis. Note that anti-GBM antibodies sometimes also form following renal transplantation for Alport syndrome. Children with Goodpasture syndrome need to be referred to a specialist renal unit promptly, as there is good evidence that early treatment improves prognosis. Children under the age of 5 have poorer outcome and are more likely to progress to chronic kidney disease than older children. So, from Goodpasture syndrome, we understand that it is a pulmonary and renal syndrome. That means pulmonary and renal features are present, and its most clinical features is that nephritis and pulmonary hemorrhage, usually alveolar hemorrhage. The nephritis features are mentioned on the question, that is like lethargy, reduced urine output and dark urine. These are the features of nephritis. It is an autoimmune disease, and other pulmonary renal syndrome clinical features present are SLE, Wegener's granulomatosis, microscopic polyangiitis and Henoch-Colin purpura. We can diagnose Goodpasture syndrome is, that is, presence of anti-glomerular basement membrane anti-GBM antibodies. Remember, the confirmation of Goodpasture syndrome is by presence of anti-glomerular basement membrane anti-GBM antibodies. Number B is the answer. Now about treatment of Goodpasture syndrome, and that is corticosteroid and cyclophosphamide and as well as plasmapheresis. So the treatment of Goodpasture syndrome is corticosteroids and cyclophosphamide as well as plasmapheresis. They are also telling that the prognosis is good evidence that early treatment improve the prognosis. Children under 5 years, remember, children under 5 years has poor prognosis in Goodpasture syndrome but progress to chronic kidney disease than the older children, more likely. Please do subscribe and share my channel everyone. Thank you.